Good afternoon. I'm Dr. Michella Dalla Piazza. I'm from the Department of Medicine and the Division of Infectious Diseases. And I'm going to talk a little bit about our transgender health program within the infectious diseases practice at University Hospital. When I first came here in 2015, our research program within the infectious diseases practice was about to open up 2 very large HIV prevention studies through the HIV and Prevention Trials Network. And these studies were looking at novel approaches to pre-exposure prophylaxis for the prevention of HIV infection. And the target populations for these studies were particularly men who have sex with men and transgender women of color, who proportionally are at much higher risk of HIV infection. In fact, we know from really well done studies that transgender women are actually about 40 times more likely to become HIV positive in their lifetimes than the general population. So as part of these studies, we did a number of community outreach needs assessments to try to see what were the needs in the community and how could we really outreach to recruit transgender individuals into these studies. And we found that there was a really large unmet need for gender affirmation therapies, including hormones and surgery. So as part of that, when I first came on, knowing that this need existed, I got some extra training in hormone therapy for transgender individuals. And we started our trans health program in 2017, with the overarching goals being twofold. The first is to alleviate gender dysphoria, which, as Dr. Einstein talked about, is the socially induced symptoms of having a gender identity that doesn't match your sex assigned at birth. And patients really, really suffer as a result of gender dysphoria. And so the alleviation of the gender dysphoria that we were able to provide is hormone therapy. And the hormones really provide a lot of support for patients who really want to affirm the gender that meets their true identity. And then the secondary goal, that is of course very important to us as well, is to increase engagement in primary and preventive care for both HIV positive women living with HIV and HIV negative transgender women. And we took a very holistic approach. Our clinic is a Ryan White funded clinic where we provide HIV primary care, so we do all of the HIV related care, but also cancer screening and other primary care services. And so we really took a holistic approach here, and I started to treat both HIV positive and HIV negative transgender women for gender dysphoria. And it really did take a lot of legwork to be able to do this. So it took a lot of leadership, which Dr. Curtin was talking about, and Dr. Sanchez as well, with the task force at UH and at NJMS, and really establishing multidisciplinary referral services with Dr. Einstein and Dr. Keith and Dr. Lavunas as well, to make sure that we had the appropriate services that we would need for comprehensive care. We revamped our environment to make sure that it was completely welcoming. We put up signs. We started asking everyone what their pronoun was and what their preferred name was. Every single patient, every single time coming to our front desk. We made sure there were patient materials in the waiting rooms that really featured transgender women and men, and we made sure that we had gender-neutral bathrooms, in addition to putting up pride flags, both the transgender pride flag and the LGBTQ pride flag as well throughout our clinic. We had a lot of training, thanks to Dr. Sanchez, safe zone training for key leaders within our clinic. We had a special retreat at which our entire clinic was required to attend, with special training on culturally competent care for gender and sexual minorities. We had a multitude of pronoun workshops and special speakers and activist invitations. And we continued with our community outreach, which has been critical in engaging with the transgender population. So we're recruiting and maintaining LGBTQ staff, including hiring 3 trans-identified individuals or gender nonconforming individuals within our clinic. We're continuously doing needs assessments, community events, including this at Pride last year in Newark. We had a fashion show called Strut that really featured sexual and gender minorities. resource guides that we're developing. We just received funding from HRSA for an intervention called Healthy Divas that is meant to help with gender affirmation and self-efficacy among transgender women living with HIV. And our research efforts continue with the AMP study and the 083 study as well, which are our pre-exposure prophylaxis studies, really targeting transgender women for enrollment into these studies. And transgender women, unfortunately, have largely been ignored in clinical studies in HIV and HIV prevention for some time. Often transgender women were sort of put into the same category as men who have sex with men, but in fact they are very, very different. It's a completely different patient population that really deserves to receive greater recognition and greater inclusion in our research studies. So I'm very, very proud to be a part of this and very proud to be able to collaborate with such wonderful leaders in LGBTQ care.